Well, good afternoon. Unfortunately, I have a bit of a cold, so hopefully my voice will hold up. I'm under enormous pressure here today. Shirley Temple. Shirley Fenton is not here, and if I don't do this absolutely properly, I assure you she will audit the tape. If I don't do this absolutely properly, I'm in deep doo-doo. So it's a hard role I've got here today. Welcome to the new year of the Smarter Health Series. This is going into now our fourth year, and we're looking very much forward to this year. We've got some really incredible speakers. After today, that is not. Our goal, by the way, today is to get Claudette to laugh on camera, because Claudette has the most pathological laugh ever recorded in human history. You're trying very hard, very hard. Anyway, it's a start of a new season. I'll try to remember at the end to say this, because I just remember Ed Brown, I believe, is our speaker the next month in the series. Or anyway, I haven't even checked that before I get down. I'm already in trouble. This will happen each month the way we have it here, and the series has been sponsored in the past by the Infernet Project, and more recently, the Smarter Health Series has been jointly sponsored by both the Infernet Project and the Waterloo Institute for Health Informatics Research. We hope in doing this that we make it interesting for people to come to the university and hear about things in health informatics. We do it so that we bring in people from the outside. Quite a few people who have spoken here have come to work with members of the Institute, and we see it as an opportunity for learning and partnership. It's part of our outreach program, which is intended to build bridges with industry. And as always, I know how busy people from industry are. I know Ron is here. I know there are a number of people from Medicalis and from AGFA. That coming to our meeting is greatly appreciated, and it's one of the purposes why we do this, is to build that bridge to you and begin a process of working with you. So welcome to the new series. The speakers today are Claudette DeLenardo first, and then Glen Kearns, talking about My Care Source, a web-based patient portal. I first saw this only about 6 months ago, I guess, when I really became aware of it. Just in the last few days, we've written a major CHIRP, the Collaborative Health Research Program grant proposal on it, to work with not only Glen and Claudette and Grand River, but also with a group in Halifax in a partnership working together on the area of patient portals and beginning to show first their effects and then their effectiveness. So it's begun something that's very, very important. We're quite impressed in seeing My Care Source, quite amazed and pleased that it came out of our community here. Those of you who read the news will realize that there's been a lot of kerfuffle about a portal called Baby Care Link. In fact, it's been presented in testimony before the Congress in the United States, because it's been shown that this portal, which is, I think, primarily for women in pregnancy and immediately post-pregnancy, is actually showing effects on reduced problems, reduced complications, better care of infants, and so on. A tremendous change where we actually see results on the patients. So we're beginning to get the message that outcomes are impacted by these kinds of systems, and that engaging the patient in his or her own health care is a useful thing to do. Not a new idea, but an idea that we haven't really advanced into action until now. So just a very brief introduction. Claudette is her degree is in nursing primarily, program director of the patient portal at Grand River Hospital. She has a Bachelor of Science from Laurentian University and has worked in the health field since 1985. I don't think you're that old. Glen, I only met Claudette about 6 months ago. Glen I've known for quite a while, and Glen is the Vice President and Chief Information Officer at Grand River Hospital. He's been around for quite a while, first as CIO and more recently for the last 3 years as Vice President and CIO. He is with the has a Canadian Health Executive designation and from CHEES, essentially, and did his work at Western Ontario and at Trinity Western University in Langley, British Columbia. I've had the chance to work with Glen in a number of capacities and watch his work. He's one of the best CIOs I've ever met. And if those of you who don't know, that's a difficult job, Chief Information Officer. The designation is generally recognized in the field as meaning career is over. The reason is that it's such a tough job that many people don't last in their jobs more than an average of about 1.5 years or 2 years. And they move on. They just have to keep moving. Glen's been around longer than that, we'll say, and has done some incredible work. So we welcome you, and we're looking forward to your presentation. Claudette?
Good afternoon, everyone. Glen and I are really pleased to be here today to tell you about a really innovative new application that we've developed at Grand River Hospital in collaboration with McKesson Provider Technologies that really supports patient outcomes. My CareSource is a patient-focused web-based application. It's been developed at this point for patients with cancer, and we look forward to bringing that forward to other disease entities in the future. We all know that when patients come to hospital, they have a lot of discussions with a lot of people. You know, they come in and they talk to the RT and the nurse and the doctor, the dietitian, the OT, the physio. They have a lot of discussions, and they have a hard time sometimes even remembering who they've actually talked to. Often we have a discussion with them, and we're meeting with them one-to-one in an office, and they're nodding, and they look like they're listening to what we're saying, but are they really? We know that from the literature, approximately 20% of the information is retained from what we've heard, and that's in the best case scenario. Now take a step back and think about how you would react if someone told you that you had cancer or any other long-term disease or acute disease. Think how shocked you would be. While your healthcare provider is sitting there and telling you about treatment options, side effects, risks, community resources, you're sitting there thinking about, how did I even get here? You're trying to deal with your emotions, rationalize how you got there in the first place. You're taking a step back. You're in the room physically, but your mind is thinking about the fact that you may never see your children walk down the aisle, never hold a grandchild in your arms. You may never see your next birthday. How did you get there? That healthcare provider is telling you a lot of information. And while they're discussing with you, you're frantically trying to gain back what they've just said. How do you spell the word trastuzumab to write down to ask them about the next time, which is a chemotherapy medication? At Grand River Hospital, we wanted to change that scenario. We wanted to say to patients, we want you to be actively engaged in our organization, and we want you to feel that you are the center of our care. We came up with My CareSource. My CareSource is a personalized support and disease management application. I'm just going to go to the web and see, I didn't get timed out, and show you our website. We're going to go through the particular modules. We actually developed all these modules basically from scratch, and we started development in September of 2003, and we were essentially finished at the end of February. So we did a very rapid development cycle. The first page is the home page, and it's a welcome page, and it says to you, you know, you matter to us, and we give you a messaging board. Basically, in Portal, you can receive messages related to 3 different organizational types of groups. One relates to personal messages. The portal absolutely supports interactive messaging with different healthcare providers. At Grand River Hospital, we haven't set that up yet. We have workload issues and concerns, and we wanted to ensure that the processes were in place to support the staff so they don't get overwhelmed with information and workload requests. Secondly, we have request messages. Individuals are able to request prescription refills or product ordering online, and that information goes to a secure organizational unit in the healthcare center pharmacy, and they can respond to those requests that the patients ask for. In the very near future, we'll be implementing requests for appointments, and those relate specifically to OT and physiotherapy services. In addition, we have broadcast messages. Broadcasts are messages that relate to patients' expressed areas of interest. So if they have things in the community that are happening, for example, on October 20th, we'll be having a Ontario Breast Fair, and that will be held in our Gold Room, and so that message will be populated on the portal. Oh. Sorry, time me up. The treatment plan is really the heart and soul of the application. We've developed to this point 17 treatment plans for breast cancer and 4 for prostate cancer, and we'll be developing 14 for colorectal cancer. Fair amount of work goes in the development of a treatment plan. We utilize clinical builds team, taking information from the literature, bringing the team together, which is very multidisciplinary, looking at the effect of different sequencing and time in terms of lab results, when they're getting their medications, when they're getting prescriptions, when they need some referrals to CCAC, etc. So we've taken that information, worked with the clinical builds team to develop these protocols. They provide a lot of information to the patient. What we used to have was, it was interesting, when I first started, I thought when I took this job everything was going to be ready. Like, I thought it was there for me. I shouldn't have thought that, because I said to the staff, okay, so what do you give the patient? They photocopied a page out of a textbook, and they said, this is what we give them. And I thought, I can't even say trastuzumab. I couldn't say that at the beginning. How can the patient even say that? So we took that information and we put it in terms of weeks and cycles of therapy. So trying to get to the most common denominator that a patient can understand. In relationship to that, we wanted to say, okay, we have all this information at the Cancer Center, and we do that in healthcare. We have all this information that we're populating for patients in paper. And we wanted to say, okay, is the paper even valid? What are the processes to say to individuals or other organizations that this is the information that Grand River supports as being valid and reliable for the patient in order to provide consistent information to them. So that information actually went and was passed through the Patient Education Committee, and then they let me know what's available and what they're utilizing for patient care. Our aim was to replicate that information as closely as we could in Portal. And so things like the chemotherapy in U-Book, which is provided by the Canadian Cancer Society, is totally replicated in the Portal. But we've taken that a step further, because we just don't want to say, okay, here's your PDF and you can go through it and find out the information. We wanted to say to patients, hey, you know what, week 1, you're getting your medications. These are the possible side effects that you might experience. So really going down again to the common denominator. Taking that a step further, we wanted to say to the patients, okay, you're having nausea and vomiting. This is something that you might be experiencing. Looking at that, we wanted to say to them, okay, if you're having this, we want you to monitor that side effect, because at some point you might run into trouble, and we don't want you to get into trouble. We want to be proactive in the management of your disease and your journey through treatment. We've provided hyperlinks, and this is the information provided by the Canadian Cancer Society. I think it's really important that while we were developing this, we had relationships with different organizations, but I can really say that as we were working through our vision and actually putting it into a reality, those organizations have really come to the table, and we've really strengthened our relationships with our community providers. And it's a wonderful thing to see groups of organizations coming together for the benefit of the patient, because that's what we're there for in the first place. Cancer therapy is very repetitive, so putting things into weeks and cycles wasn't such a big deal. It was actually getting the staging appropriately. And it's interesting that the feedback from healthcare providers would say, you'd get the things from the literature and they'd say, nail changes, et cetera, et cetera. Not this week, next week. This is what we're seeing. So we're actually taking that information and we're putting it into a relationship of what actually is seen at our organization. So some people may say at a different organization those side effects may occur at a different time, but we're looking at what is actually seen in practice by our oncologists and our supportive care coordinators. You'll notice that we've provided a calendar for the patient. Really important. Patients need to know when things are happening. They need orientation to real time. Interestingly enough, I would challenge the clinical staff and say to them, okay, so when does this happen? And each and every one of them around the table pulled out a calendar. And I said, so if you're pulling out a calendar and you're working with this every single day, how's the patient going to figure it out? They need a calendar. So we had a little bit of a back and forth with our developer, and we were able to put the calendar. And actually he said to me, you know what, you bugged me enough that I couldn't listen to you anymore, so I put the calendar in there. We also have links to appointments. And appointments is a really big deal for people because they come, it's going to come eventually, they come to the Cancer Center, and the current process now is that they get a paper document, which is called their patient itinerary. And the patient itinerary is invalid in about 35 seconds, really and truly. We have patients that come and they have to wait for their treatment because they haven't had notification that their appointment's been changed. And cancer therapy appointments get changed very, very quickly and all the time. And so we wanted to change that perspective for the patient so that they have a real-time view of their appointments, that they could see when they're coming for and where they're going. Taking that a step further, the scheduling software we have and the language in it is very provider-centric. Absolutely true. And you'll see that by something, you know, systemic nurse 3, like what the heck does that mean? So we thought, let's take that information or that descriptor and build some content related to that to tell the patient who, what, when, where, and why. We wanted to do that, and it was interesting during the pilot. We, as I, subscribe patients to the portal, one of the questions was, do you think you're going to use this? Yes, I will. And we clicked through the hyperlinks that were associated with the content of those descriptors. And something as innocuous, I thought, oh, it'll be nice to have a picture of the systemic therapy suite and the CT sim room. Patient said, there's my treatment chair. I'm going to show this to my family. That's where I sit every time I come in for treatment. So very, very powerful, and a lot of ownership that happens as patients are engaged in clicking through the information and feeling the support. As I said earlier, we're going to be doing a pilot looking at appointment scheduling for multidisciplinary staff members, and we're really looking forward to that, where patients can actually request an appointment. We didn't go down to the self-schedule yet. That's too scary for people, right? The portal is scary enough, but actually saying to them, we want you to have interactive messaging, and we want patients to schedule their own appointment and get their lab results is pretty intimidating for healthcare providers at this point. Side effects is a really, really important part of the portal. What we did was build side effect reminders in the content library. So the things that you saw in the treatment plan, we built that reminder to say, you know what, if you're having this side effect, we want you to come in, we want you to monitor, we want you to bring the information in, because we're using validated scoring tools that we've converted into patient language. We've eliminated the medical jargon. And an example of that would be something like mucositis, stomatitis. We spent an hour. 8 people spent an hour trying to decide how we were going to describe that in portal, which we came up with mouth-to-bottom soreness. So, but very, very simple for the patient. They can relate to that. I mean, I couldn't relate to mucositis. So we took that information and we used the validated scoring tool. And interestingly enough, those scoring tools are provided for healthcare professionels. The response from the pilot was, can you start all those tools off at 0? We want to self-monitor ourselves when we're 0, when we have no effective therapy. And I thought, oh, all right, yeah, sure, we can change that. That's not a problem. But interesting enough that they did that. Because the pain and the fatigue score, the two probably most utilized scores in chemotherapy or cancer therapy, are pain and fatigue. So they wanted to make everything consistent. So a lot of really good feedback was obtained through the pilot process. The medication module is basically central to our return on investment, our business case. And what patients can do through there is order prescription refills online. They can order products, and they can transfer prescriptions from one pharmacy to the other. We have some movement on there. We have some patients who are routinely ordering medications online, and I think as we grow, we'll see more of it. What we're trying to do is connect the information related specifically to the type of medication they're taking with some additional content, for example, through Cancer Care Ontario. We're using their drug data bank to do that. The profile provides a very concise spot in which patients can build a health profile for themselves and family members. We're not going there. It takes a while sometimes. And what we've heard from patients is that, you know what, I have my insurance information somewhere else. It's not going. It's trying. It's just sitting there. What we really would like to do with the next phase is actually have an interface with our ADT system where patients' demographic information can flow back and forth, and they can update that automatically. An example of things that don't get updated in healthcare, we have patients that are coming to our cancer center right now from Credit Valley to receive radiation therapy, and was working through an issue with one of the patients, and I said, well, this is your address. This is what is showing in the ADT. And she said, that was my address 4 moves ago. So information is obviously not being updated. Can you imagine? We're asking them to put emails in there too, and we know who doesn't have their email active because it gets kicked back to us in our messaging center. Oh, what happened? Let's see if we can refresh. No, I could try it again. I guess this is why we shouldn't do live. There we go. The team module really is a way for patients to get information about their team members. They can select their team members by going into the editing feature, and it populates their particular group for them. We give them some information in terms of how to contact healthcare professionals. You'll notice that we have a lot of 5773s because that goes to the triage nurse. That's the process we utilize in our cancer center because patients are calling in and they're in crisis. And we don't want that to go to a voicemail box. We want them to talk to a real person where they can have a dialogue about their side effects or symptoms so they can be assessed in order to receive the appropriate interventional therapy. We also provide a wide list of community resources for patients to access, and we know that patients are accessing this information. We're able to pull crystal reports on a monthly basis, and we know that they're clicking onto these sites and moving forward. The diary is a really nice spot where patients can document their feelings, their emotions, what they're going through. Some people, you have both sides of the fence. Some individuals won't. Absolutely not put anything in there online, and then you have people that use it all the time. One patient described the use of her diary as her therapy, and that she utilized that and shared that information with her 2 children in the evening, so they shared her journey through treatment. So, it was a bad day for me because I had a tear in my eye when she told me that, but really, really, at that moment in time, I thought, we have actually done what we wanted to do. We have actually engaged patients with our organization. So even if we do that with one person, we've done our job. The question section is growing, crazy growing. We're building these questions through the clinical builds team, and I've said to them, I want to know what the questions are that patients ask you all the time, because they're asking those questions repeatedly. And when they come in, they'll have 20 minutes with you or your oncologist, and you don't want to waste those 20 minutes asking the same question over and over again. You want to get to the important things that matter to the patient, that are going to give them some relief in terms of how they're thinking and how they're reacting emotionally. So we're grouping this off. We have 2 big things coming in terms of FAQs. Questions about genetics and genetic counseling, and questions about pain and symptom management. 2 really big hot items that we'd like to populate on Portal. And then at the end, we have a discussion board, and as we build new treatment groups, we're putting more discussion boards on. This was a request through the pilot, and we put it on. It's not being used a whole lot at this point. I think it'll grow as people feel more comfortable and more engaged, and I think there's a bit of a safety net. You can look at it both ways. There's a safety net in that it's the patients that are at the Cancer Center that are using this, that are in portal. So it really narrows the field in terms of who that person might be. But it's available for people. They requested it, and we didn't have an issue putting it. It's not a monitored discussion board. It's basically posting questions to other patients who could offer some collegial or peer support for others. And then we have a section on technical support and feedback that patients can provide for us, and we provide them with a notebook section in the FAQ section, can't say that word today, so that they can write down the questions that are important to them to ask the healthcare provider if they haven't seen an answer in the portal. So really trying to promote, obviously, patients being engaged in their treatment, taking some ownership in terms of their therapy, making decisions, really supporting family members. We know that family members are online with their loved ones, looking at the portal. And I think at the beginning we didn't really think that was going to happen. We wanted it to happen, but we know it is happening because I've gotten calls from people who've requested some information or have gotten some comments from patients. So very powerful. This is a quote from Allison Armstrong, and I have her permission to have this up. Allison is an amazing woman, very helpful during our pilot and beyond in providing us with feedback. And we asked her, you know, what do you want to say about the portal? And she said this. She said, you can find a lot of information online about cancer, but it's very general. This is very specific to you. In the middle of the night, if I can't sleep and get up, if I have questions, the answers are there. And so this is what we really wanted to do, was provide answers for patients, actively engage them in their therapy, and support them through their journey while actively engaging them with our organization. Glen's going to tell you about how we got there.